Eyelid surgery can be a real powerful surgery, and that doesn't mean that it's one that necessarily jumps out at somebody. It's been said that the eyes are the window to the soul, and it's a thing that can really be apparent on you if you look at somebody and their eyes are sagging or they have extra skin and they just look tired. And a lot of times what I hear patients tell me is that on the inside they feel very youthful and young, but on the outside they feel that it just doesn't match and their eyelids look, sad or tired and that type of thing. And so eyelid surgery can be very helpful and powerful in improving that. So eyelid lift or blepharoplasty are the common terms that we talk about with that. Sometimes people need a brow lift in addition where their eyebrows have started to drop with aging, and those can be lifted as well. But with the incision that hides in the creases above the eye or oftentimes in the space right below the lower eyelashes, you can have a surgery that really cleans that area up. And there's a lot of different technical details that we talk about at the consultation with what that patient needs specifically, but it really opens things up and cleans things up. And the goal for it is really to not have it be where somebody who comes up and talks to you who doesn't know you would think that you've had anything done at all. You just look clean and fresh and you match up with your face and that type of thing. Now, if you look at yourself compared to before, or if somebody who knows you looks at you compared to before, they can tell that things are different. But oftentimes people are getting the comments from their friends that, what's different? Did you change your hair? Did you get better rest? You're doing different something. They can't quite put their finger on it. And that's actually the mark of a good surgery oftentimes, is that things just look all natural, in harmony and pleasing, not that you've had a surgery done and things look abnormal. So for eyelid surgery, just any facial rejuvenation, facelifts, etc., you're going to obviously have some bruising and swelling. Most of that is in the first week is the worst part, and then tapering down over the second week. Even sometimes it's 2 weeks, sometimes people have a little bit of residual bruising that can be camouflaged very easily with makeup. And how much time to take off work is kind of a multifactorial thing. A lot of it depends on the patient's threshold and what they do. So some people may not care if they have a little bit of bruising still and they go back to work, and they may go back to work in about a week or so. Other people, they want to have much more natural appearance, and they may take even longer, and it depends on what the patient does. If they're around people face-to-face, customer service, that type of thing, they may need to take a little bit more time off versus somebody who has a desk job and they don't mind that their coworkers know that they have something done because they're proud to share that. You're going to see the initial results obviously immediately, but camouflaged by all the bruising and swelling. But by 2 weeks, you're going to see a lot of the changes there that are now not camouflaged by all the bruising. And really you need to give yourself, though, a couple of months for things to kind of really settle in to where they are for the most part. The whole healing process really takes about a year, but it's, like I tell people, it's a curve that kind of is front-loaded so that your recovery is more in those first 1 to 2 weeks, and then as scars mature and these little fine details of things just looking more and more natural as time goes on is kind of the typical way that the healing process goes.